guys, this is Dr. Puleni. I'm a family and a cosmetic dentist. I have been receiving a lot of questions from my patients on what is flossing, what are the benefits of flossing, what to use to floss, when to floss, and what not to use to floss. So in this tutorial, I will be covering all of that. Thank you for tuning into my channel. Today I'll be talking about dental flossing. So dental flossing is using a string or a dental floss to clean in between your teeth, to remove plaque and food that is stuck in between your teeth. What are the benefits of flossing? What is flossing? Using a dental floss, it helps to remove the plaque and also the food that is stuck in between the teeth. Therefore, you minimize the process of getting gingivitis or gum problem or having teeth that have cavities or rotten teeth. So it's important that you floss every time after you've eaten, or at least once a day, probably at night, you need to floss your teeth. Which floss would you recommend? I recommend the Queen of Clean. You can get it from your nearest dentist. It is my best floss now after the Johnson & Johnson. This used to be my best floss, but since this one came, it's number one. So number one, number two. What is the correct way of flossing? So your floss, you just need about 30 centimeters of your floss. Then you just wrap it around your fingers, index finger, secure it with the thumb, use the middle finger to position it. You only need about a centimeter to balance your floss so that you can be able to floss properly. So the technique is that you move the floss back and forth. Starting to floss, I need to gently get it in my mouth. Don't push it in too harsh. So I'll use the back and forth movements like this. So the floss must reach the gums, because if it hasn't reached the gum, then you haven't cleaned properly. There's still some plaque that is stuck in between your gum and your tooth. So you need to floss to make sure that it goes, you must push it in until it goes to the gums. And just be gentle with it. And then you go to the one side and to the other side. So this is the procedure you do in all the teeth as well. So if I were to use to floss on the upper teeth, this is how I'll do it. So it reaches all the way to the gum, and I move the floss to the one tooth and also to the other side of the tooth, and then I put it out. So when there's food stuck there, I need to repeat the procedure until I'm sure that everything has come out. If there's food, the food has come out. So on the bottom, I have to do the same procedure. Okay, so I have to do the whole mouth. Preferably you start on this side, going all the way to the left, from the bottom left all the way to the right. This is the mounted floss. For beginners, it's easy to use. So this one also works the same way. I'll show you. Okay, so after using that floss, then you just throw it away. What happens when you don't floss? So let's say there's something stuck in between your nails. Obviously, it's gonna be irritating. You'll have an irritation. If you leave it longer, then it's gonna start swelling. It's gonna be red. If you leave it longer, then it's gonna turn green and pus is gonna come out. So it's the same thing that happens in the mouth. If the food is stuck in between your teeth, or there's plaque which is left there and then it hardens to become calculus, it causes irritation between the gum and the tooth. If the irritation is not removed, or that bacteria or that plaque or the calculus or that food is not removed, then the gum gets discomfort, and then it causes swelling, irritation, and then the gum starts to swell. Then you have bleeding gums, and then if it's not treated still, then you end up having pus. So with time, you find that the irritation and all the infection that is in there, it causes destruction of the bone and the gum. So with time, the bone is eaten away and the gums is in a way, and then you find yourself having gingivitis, which proceeds to be periodontitis. So that is the ultimate gum disease, if I can say it. So it starts with the healthy gum to periodontitis. So that's how important flossing is, because just by flossing daily, you remove the plaque. If you don't floss, the plaque hardens to calculus, then calculus causes more irritation, and the more food that is stuck with the calculus, then there's more irritation, and you have gingivitis, which proceeds to periodontitis. So it is important to floss. If you find yourself that you already have calculus, you need to see the dentist. You need to visit the dentist ASAP.
What not to use to floss?
So there are things that people use, and I'm even ashamed to show them, but I'll show you guys, that they use for flossing. Maybe you're one of them. Let's see. Dun, 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 dun. The toothpick. So basically the toothpick, it damages the gums, it damages the bones, and then and then you have some bleeding on your gums, and then introduce more bacteria in your gum. So actually by doing that, you're just pressing more on the gum and pressing on the bone, and then you're chipping a bit of your bone every time you're using the toothpick, and open up a bigger space in between your teeth, and then food gets stuck in there, and then more bacteria get stuck, and then you end up having a big hole in between your teeth, and you end up losing your tooth. So basically a tooth floss, it means picking your tooth in a long run. Number 2, paper. I've seen people doing that. Like, I don't need a floss, I have a paper. These things I know, that do I thinking. Okay, don't do that, because it doesn't make any sense. It doesn't go all the way to the gums like the floss does. So you definitely need a floss. Number 3. I've seen people doing this. It saddens me. But anyways, it is so wrong, guys. Don't use the paper, don't use the plastic, don't use any stick that you find on the ground or wherever, because it has bacteria, it's been contaminated with who knows what bacteria. Then you're introducing those bacteria in your mouth. By the end of the day, you don't know where you've got the gum problems and all the other problems that you might have during the introduction of those bacteria in your gums. So don't do that. Either stick to your floss and throw away your toothpicks, or the handheld floss as well. The other technique that you need, like I said in my introduction, that I'll be using all the things on the tray, is that it's a tongue scraper. Just to clean your tongue, you just fold it and then you scrape your tongue to make sure your tongue is clean and fresh. You have your mouth rinse. The brush, definitely need to brush your teeth after flossing, and the toothpaste. So the mirror, guys and girls, you need the mirror. So basically when you're using it, I'll just do the tongue scraper. You need to see your bacteria coming down. Yeah, seriously, I'm serious. And then scrape it all out, and then clean it. And also with your flossing, you need to look at yourself to make sure that you're flossing properly. But then with time, then you don't need a mirror. Also with your brushing as well, especially when you're brushing on the inside, you need the mirror to look at yourself. Look at yourself in the mirror so that you enjoy this procedure. And then you make sure that you can see things and the places that you're missing when you're flossing and brushing your teeth. So guys, that's it on dental flossing today. I hope to see you in my next videos. There's so much more that I need to teach you about the oral care, or just taking care of your teeth in general. I hope this has helped you guys. This was fun for me. Please subscribe to my channel. Please, I'm serious. Subscribe.